I'm Annie Jinx. I'm a clinical psychologist and I work in CAMS West in Somerset. And I've been a clinical psychologist for nearly 17 years working in CAMS. And I'm here today to talk a little bit about the trauma recovery model and how this underpins interventions. I also hope there's a bit of time to also talk to you about trauma-informed care in our service, but we'll see how we're doing for time. Okay. So this really is an introduction to the trauma recovery model because I think you can't really do the whole thing justice in 15 minutes. So it is a very much a whistle-stop tour. And I hope that people will go on and do more reading and ideally do the trauma recovery model training, which is a brilliant training. So it was developed, the trauma recovery model, by someone called Dr. Tricia Skews and Johnny Matthews. And they are both, Johnny particularly is a very charismatic trainer and has written many books. So I would really highly recommend that you can go along to their website and look at their resources, but also get their training if you can. So it was developed in the Youth Justice Service by Johnny and Tricia, who were working with really complex young people. And what they started to notice was that actually these young people, they weren't customers for what we would consider traditional therapy. So they would often have community treatment programs, anger management, for example, or CBT type approaches, but they weren't turning up. And they thought, hang on a minute, we're not really meeting the needs of these young people with highly complex needs who are committing sometimes serious and violent offences. And they wanted to really kind of try and understand what was going on and actually think about, for the practitioners and the people working with these young people, what might be a helpful framework to understand how we can work with these young people. So, and they also did a lot of research into in the young people that were accessing youth justice services and involved in crime. And as we are now much more aware, I mean, they started their work in early 2000, but that there is so much evidence to say that these young people had very often traumatic pasts and were exposed to domestic violence, abuse, and neglect. So they were really trying to think about how can we approach the needs of these young people that aren't turning up for what we would consider traditional talking therapy approaches. And so what they did, they kind of looked at all the kind of research into trauma and attachment and tried to kind of pull together a model that really looks at the psychological and individualized needs of these young people and to try and think about where we could target our interventions. And I think that, I mean, I realize we've got people from multi-agencies, but I think that's really kind of important to think about with CAMS as well, because of course, many of our young people don't necessarily want to turn up for talking therapy to sit one-to-one and sit opposite an adult. And it really makes sense that actually we need to think a little bit differently and meet them where they're at in terms of their needs. So in essence, the trauma recovery model is a framework to try and understand the needs of psychological needs that underpin the behaviours that we're seeing, so we can have developmentally appropriate interventions. There's also something that Johnny Matthews, who developed the model, is very keen to say, that there's a real emphasis on hope and redeemability, and that actually really complex and relational trauma can be resolved by building safety and new and trusting relationships. Okay, so I will try and give you a little bit of the underpinnings, but it sounds like you're going to get a bit more theory with Joy McRae next, so I won't try and be too repetitive. So don't worry, I'm going to show a bigger copy of this triangle in a minute, because this is essentially, this triangle is the trauma recovery model. So it draws on existing theories and understandings of, like I said, so at the bottom, it makes sense that if you've heard of Maslow's hierarchy of needs, Maslow was writing in the kind of 1920s, but he kind of spoke about if a human being is unsafe, is in physiological danger, is not having their basic human needs met in terms of safety, food, sleep, that they cannot do anything else. They are in survival mode. And basically that is part of the foundation of the trauma recovery model, that we have to think about where a young person's at. It also draws on the cognitive theory of developments from someone called Piaget. Again, he was writing in the kind of 1920s, but he had a kind of theory of cognitive development and how young people learn and develop problem-solving abilities is about how they explore the world. And what was really important for the trauma recovery model is actually that we were expecting young people to turn up and do something, you know, such as CBT therapy, which requires logical thought and executive functioning abilities and the abilities to think about thinking. And actually, they hadn't actually been through that stage of development, that they didn't have those cognitive abilities yet. And of course, a big foundation for this model is attachment theory. And I understand Joy is going to be talking to you more about that. But actually, it's really fundamental to this model to think about how young people are building relationships with the people around us. Because if we are expecting people to turn up to CAMS for therapy, we're expecting that they can trust adults. And actually, as we know, so many young people who have been abused and neglected and hurt by adults around them, it makes sense that they're not going to be readily able to trust the adults that they're working with them. And we have to persevere with them, and we have to enable them to feel safe with adult relationships. It's also based on a lot of the neurodevelopmental and neurobiological research, which really is now showing and shining more light on the really profound neurobiological changes that happen when young people are abused or exposed to high levels of trauma, both in the womb and in those early experiences with their attachment and primary caregiver. So it's pulling together a lot of theory, and like I said, I couldn't possibly explain it all in 15 minutes. So I really advise that you go and do some further reading or go on their training courses, because they really explain the theory and it help you kind of make the connections between attachment theory, the neurobiological impact of trauma, and then how that really feeds the level of the intervention of where we should be aiming our interventions. So I might just give you a little quick look at the triangle in more detail. Apparently I can do a little kind of laser pen. So is that working? Can you see that? Yes, you will get access to the PowerPoint, of course, and you can actually download a copy of this triangle on the Trauma Academy, Trauma Recovery Model Academy website. So just if you look, can people actually see the writing on the triangle? I hope they can. But if you look at in the middle, this is the behaviors that we are seeing. So if you're at level 1, it's that kind of base level Maslow's hierarchy of need. This is when people are displaying in their behavior, challenging behavior. They might be aggressive, they might be self-harming, they have dangerous or inconsistent living arrangements, and they are not safe. So at that level, the primary intervention, which is here on our left-hand side, is to try and get them safety, consistency, and routine. And the underlying need, so the needs on the right-hand side, is for structure and routine. And this is kind of the foundations of any good attachment relationship. Without these things, we cannot have what would be referred to as a secure base, because we cannot have safety. So, and once we have those things, we can start to think about how we, on this level, start to go through this threshold in terms of building a relationship with a trusted adult. And actually, often this is where people come into services, and at level 2, where we're thinking about how do we build relationships with young people who have had really difficult trauma in their background and may be very untrusting of adults or very scared of adults, and be very much more reliant on peers and peer relationships. Like I said, this is zooming into where we would need. Firstly, we need safety. We need that young person to be in a safe place. Then we need to think about how we can start to build a relationship with them based on the kind of fundamental principles of attachment. And they talk about CPR in the trauma recovery model, which is that consistency, predictability, and reliability. And that's something that's replicated in an attachment relationship, in terms of a secure attachment relationship. Children aren't born with an ability to regulate themselves. That comes through their relationship with their attachment, and the caregiver with their primary attachment. And that, of course, we know helps young people to repair that internal working model, that template they have for how they see the world and relationships. So just on a very fundamental level, if we can give the young people consistency, predictability, and reliability, they are more likely to engage and make a relationship with us, because we are trying to replicate that relationship that they may not have had because of their trauma in their early development. And that we can do in a really simple way, but just doing little things. And when we talk to our participation group, what helps the young people make them feel safe and build trust is us being predictable, turning up, predictably turning up, even if they're pushing us away. Making sure we give them the same day, same time, same place if we can. All those little things can make a really big difference to our young people, and especially those that have neurodiversity, because actually the world can feel very unsafe for them anyway. But actually those little things make a big difference. So on that kind of first level and moving up into that second level, because at the top level, this is where they might be coming to me for EMDR, for trauma interventions. But so many young people aren't there yet. They don't have the cognitive ability, and that's because we know that they've had a traumatic start to life, and that would have affected their neurobiological development. But they also don't fundamentally have that ability to trust another adult, let alone start to share and disclose and be able to talk to them about their trauma. So we really want to be thinking about how we can build these relationships, and that doesn't have to be with a trauma specialist, with a clinical psychologist. That can be with anyone in their life that can give them a sense of, I care about you, I want to build a relationship with you. And I think in that lads talk yesterday, someone was reflecting how important just the dinner lady was, because it was someone that was consistently showing nurture and care, and that is so fundamental when we are trying to build attachment relationships with young people who have had so much attachment trauma. I'm going to have to skip a few of these slides, but these are the things that we know are so important when building a relationship with young people. I'm hopeful that Joy is going to talk to you more about Dan Hughes, his PACE approach was developed for supporting people with developmental trauma, as in trauma within their development and their early attachment relationships. But it can be used across the board when we're thinking about how we connect with young people, which is so fundamental. And for example, in my job, you know, I think it's just thinking about little things that we can do. I always have a game of Dobble in my bag, for example, but how can we connect with them in a way that we can replicate that shared attention, shared intention, so that they can start to think, maybe this adult is okay. Maybe this adult can be trusted. Maybe they keep showing up. Maybe they do care. Maybe this is someone I can sit with and talk to about some really difficult things. And I think that we know that about the importance of play in terms of learning these skills, but yet so many young people with complex trauma haven't had those opportunities, and therefore they find these things really difficult. Young people don't just develop emotional regulation skills, they develop them through that relationship with their primary caregiver, and they make sense of that, the world, through that relationship. So what we're trying to do as the adults working with these young people is we're trying to replicate that in a way that can help that young person feel safe. And that's about turning up, forgiving quickly when they push back, helping them learn through play, being predictable and reliable, despite whatever they might be bringing to a situation. Despite however many times they tell you to F off, it's about really trying to kind of go, I know you're scared, I know you don't trust adults, and that's okay, and validating their experiences. Those are the things that we absolutely should be courteous and respect each other, and respect what a difficult job we do, but most of all respect the young people that we work with. And the whole kind of foundations of the trauma recovery model is to really kind of understand where their behavior is coming from. If they are getting angry or upset, or they're not turning up, that's because of the trauma they've experienced. That's because they don't have possibly the cognitive skills. They don't trust adults. They don't, they have chaos and instability and lack of safety in their life. So we have to understand and see their behavior for what it is, and then try and connect them at a level that is appropriate for where they're at. I realise I think I've run out of time now, Steve, have I?
You have, very slightly, but
Okay.
I'll forgive you.
So I'll just go back to the model, but please do go and look on the trauma recovery model website. They've got lots of resources and videos. That it's a kind of a way. So you look, so if someone's, you know, maybe they've already got that relationship with a trusted person, and maybe they're starting to disclose at this level, that might be the thing where you think, actually, now they've got those relationships, can we think about what type of therapy might be appropriate? But for so many young people, they're at this level, and it's thinking about how we can work with them, connect with them, build trust with them, so they start to repair that really difficult relational trauma they've had, and start to see themselves as likable and lovable, despite the amount of abuse that they may have had in early years.